Okay, we're going into a work session to get an update on the bridge project, City of Vancouver. Oh, I know, the bridge shelter, that we don't want to confuse those things. So City of Vancouver is here to tell us how things are going with the shelter. Just please introduce yourself and take it away.
Lights on and muted. Okay. Does that work? Okay, good. I'm Jamie Spinelli. I'm the homeless response manager for the city of Vancouver. I brought Kevin.
Can you hear me? And I am Kevin Kearns. I'm the project manager for this project within the General Services Department of the city.
Okay. Thanks for having us. I talked with you guys, I think last May and June, I believe, where we didn't have nearly as much information as we have currently about the project. We are very, very early in planning. So I'm going to give you some background and some context for the kind of the purpose of the project to begin with, particularly since you have some newer counselors, to make sure that they are caught up. Overview of the bridge shelter in general, kind of some details about that, and then we can get into some discussion or questions if you all have that. Next slide, please. Okay, so this really just to provide some context, and the first handful of slides are going to be similar. Shows what homelessness, both sheltered, unsheltered, and chronic homelessness looks like, or has looked like over the last decade or more. And you can see that the dark blue bar shows sheltered, and the green one right next to it is unsheltered. And you can see that our sheltered population, this is countywide based on point in time counts every year. Sheltered numbers remains kind of steady over years, and that's largely because we did not expand shelter capacity in this community for at least not in an early meaningful way for many, many years. So as homelessness continued to grow, just overall, the number of people living outdoors continued to climb. And I think starting in 2019 until 2024, we had more people living outdoors than we did indoors who were experiencing homelessness. And then that red arrow at the top, that shows where we were last year. And we had a slight decrease in unsheltered. I think it's 0.4%, which we'll get into in a minute. So that would lead us to believe that we're hopefully leveling off there. And we would like those numbers to go down, those unsheltered numbers to go down, because living outdoors is very difficult. The lines that kind of go through the middle show you kind of total chronic homelessness. For anyone who does not know, chronic homelessness, HUD defines that as anyone who's been homeless for a year or more, consecutively, or 4 or more times in a 3-year period, and also experiencing some kind of disability, living with some kind of a disability. The longer someone lives outside, if it takes a very long time for them to get back in, the harder it is for them to get out of homelessness. They start picking up more barriers, and we'll go into that in a little bit. But as you can see, those numbers, as well as chronic unsheltered, kind of continue to grow for many years. Next slide, please. This is just very kind of high level point in time count for January 2024. That's the pit count. The 2025 pit count is coming up at the end of this month. But last year, around this time, we counted a total of 1,366 people experiencing homelessness. That's both people who are living in shelter, people who are living in transitional housing, and people who are living unsheltered, so in a place not meant for human habitation. We saw some good things occur, in last year's data. We saw 13% more people in shelters than we had previously, and this is largely due to the City of Vancouver's increase in shelter capacity. So we've added some safe stay communities over the last few years that have added capacity. Bertha's Place also was added in 2021, which is great, and Bertha's 2 came online. So we have, in the last few years, really, I think, made very intentional efforts to increase indoor options for people. And then a big number, 47% more people who are chronically homeless in shelters. They are usually the folks who are living outside. But I think that shows if they are given options for indoors, they will take them. So while we had a 5% increase, like more homelessness, it's not a massive jump. We did have a 0.4% decrease in the number of people living outside, which again, it's the right direction. Not exactly where we want to be. I put it in red. There are 43% more unsheltered families this year than previous years. And I want to say probably a very good chunk of that are people who are living at our safe park, because people living in vehicles are still considered unsheltered, even though they're in a kind of more stable, safer environment. They're in vehicles that are not necessarily intended to be lived in. And because we have the safe park, we're kind of now able to gather that information, whereas people would kind of scatter and be kind of hidden in neighborhoods or maybe scattered across households. You know, you have kids staying at various family members' homes with their parents living in a car. That happens all over the county. We're seeing that actually, we opened some winter shelters this year in some city facilities. And I was actually kind of surprised myself. I've done this for a long time, but I was kind of surprised at the number of families we saw come into the new shelters. I thought we'd get a lot more singles and couples, but a lot of families came in right out the gate. And I was like, where are they the rest of the time? Why haven't we seen them? And it's for that reason. They've had their kids kind of scattered, you know, family, friends, whomever, and having the shelter gave them the ability to be in one place together. So they are taking that opportunity. So of course the goal is to find them somewhere to be before winter shelter ends. We'll see how that goes. So 669 people were counted countywide without shelter. We saw a 6% reduction in chronic homelessness and a 36% decrease in chronic unsheltered homelessness, which again, that's the numbers going the right direction. Next slide, please. So in addition to, so what I just gave you was the countywide point in time count, bits of the point in time count from last year. So the city has our own outreach team that does work just within city limits, the HEART team, Homeless Assistance and Resources team. And we do our own count in the summertime. We keep it as similar as we can so that we're kind of capturing very similar or the same data. We do add some additional data points to our surveys, but we try to keep it as close as possible. The method is a little bit different. So the point in time count is typically done just on a single day in January every year. And that does not give you perfect data, but it does give you the ability to look at trends, monitor trends over time. So I think nationwide, it's known to be an undercount. It's far from perfect, but it does allow you to look at trends. And so because Vancouver was really looking for as kind of complete data as we could possibly get, we spread our count out. My team spreads our count out over like a 2 to 3 week period. And we really count until we've gotten everyone that we can possibly come across. One thing that we added this year, well, the two things we added this year. One is that people who are in jail, people who are in hospitals, who are in treatment, who are otherwise homeless, are not typically counted in the point in time count, which is one of the reasons you're going to end up with an undercount every year. So in an effort to just kind of see what would it look like, how many people would we have outside if we counted the folks in jail. We looked at a single day in July, and 46 of the individuals in jail identified as experiencing homelessness, so would have been outside had they not been in jail that night. So tack another 46 people onto whomever we counted. And then the other additional thing we did for our count this year, I don't know if you guys are familiar with Secure 39ers. They work with the Chuukese population. They kind of are the hub for that community here locally. And they had expressed a need for some of their own data for their consulate and had reached out for just kind of where do we go for this? And we were just getting ready to do our count. So I couldn't help them with kind of like community wide, but I could certainly help with unsheltered in Vancouver. So we were able to give them access to our tool, our survey and our tool. And they were able to go out to the unsheltered community to ask our survey questions as well as some of their own for information that they wanted, data that they specifically wanted to capture. So I would say that probably also contributed to more kind of accuracy and completeness in our data. Again, not perfect, but that is particularly the unsheltered community. That is a population that is a bit more standoffish with my team and other outreach teams, particularly if there is a language barrier. Not everyone is very fluent in English. Some are, some are not. And we represent the government. So if I lived outside, I'd probably feel the same way, if I'm being honest, although my team is very nice. So we got a lot of good information. Secure 39ers got some good information, I think, that they were seeking, and we were able to get more complete numbers as much as we could. We counted a total of 488 individuals. Not all of those individuals agreed to do the survey. Some of them were in jail, and others just were not interested. But 311 agreed to do the survey. And of the folks who agreed to do the survey, 96% met HUD's definition of chronically homeless, meaning they had been outside for longer than a year, or they'd experienced homelessness many times over a 3-year period, and they identified as having some kind of disability. It's a huge number. 35% of those reported becoming homeless outside of Vancouver city limits. And that's one of the things that we kind of drilled down on just to get, as close to accurate as we can. There's lots of people who live in unincorporated Clark County who have Vancouver on their, on their address, who, if just asked by an outreach member, during point in time count, they're going to say they became homeless in Vancouver. And not everyone remembers their last zip code. So they will likely be given 98661 or whatever an outreach worker, thinks of it, wherever they're at in the moment. So this is the kind of our best estimate as to how many became homeless outside of Vancouver city limits. I can tell you that the bulk of the folks who came from outside of Vancouver city limits came from elsewhere in Clark County. That's the number one kind of like next came from. That's where they became homeless. After that, it moves to from somewhere else in the state of Washington. And then after that, it's across the river in Oregon. And then there's ones and twos from other states, very small numbers, but the bulk of it
Can
is
I ask
right.
a quick question?
Yes.
Just quick question on the outside of Vancouver, 35%. What do you know what percentage that is other cities, jurisdictions or versus unincorporated?
Let me see if I put it in my notes. I didn't, but I can get it to you if you'd like. I can send it to you because I've got my whole spreadsheet.
Great.
Yeah. And so when you kind of look at both sets of numbers, right? Clark County's total pit count number, people experiencing homelessness, and how much we're able to count in the city of Vancouver, it would appear as though about 70% of Clark County's total homeless unsheltered population is currently residing within Vancouver city limits, which is more than becomes homeless here. So we are hosting a number of folks, which is, it's people can be wherever they want to be, but it does put a strain on our resources, on our capacity, which is why we declared a state of emergency in November 2023, just because what it takes to support that number of people living outside just far exceeded what we had kind of regular capacity to support. Next slide, please. And these are the next few slides, I think, are really going to talk about just kind of some of those impacts that we're addressing. So my team I have a multidisciplinary team from public works, law enforcement. I've got some outreach specialists. We're about to hire some additional outreach specialists. And their role, all of them, primary role is outreach and engagement, but there are some specialty roles. Sheila, who is on the middle of that picture there, is in the public works department, and she assesses encampments for cleanup, hygiene, sanitation needs, and then coordinates all of those things that are needed, whether it's dumpsters, porta potties, trash pickup, whatever. And then we do some large scale kind of camp cleanups. We're trying to leave people in place where we can so that they can stabilize, not be moved around, stay connected to services if there are no other options available. Sometimes we do have to move folks around because the solid waste has just gotten too much. And we, in last year, picked up over 400 tons of solid waste off of public property just from our cleanups. And then we take referrals or app submissions. We have an app where you can report, a camp, whether it's because of something that needs to be cleaned up or someone who might need help. So we track the number of app submissions, where they come from in town. And then the law enforcement on my team, in addition to the outreach and engagement, are I believe the source of like 98 or 99% of the citations into community court, which is a fantastic partnership between the city and the county. Community court, for anyone who is not aware, maybe for the public's benefit, is very, very similar to other therapeutic courts, where the goal is to connect people to the supports and services they need to really to kind of get them out of the situation that got them into court in the first place. In these cases, it's often very low-level crimes, whether that's, trespassing, unlawful camping, unlawful storage of property, urinating in public, things like that, often associated with homelessness. And we've got a ton of amazing providers that spend several hours with all of us on Friday afternoons in community court. And people are, essentially kind of like mandated. They get to opt in, but if they opt in, what the goal is to connect them to what they're not connected to now. Housing assistance, so like a housing assessment, mental and behavioral health assessments. There's a small amount of community service or community restitution, which is typically done at Mabry, which is kind of gardening largely. So again, really every effort to be therapeutic with it. And the bulk of those, what comes through community court does come through the HEART officers. But so this is just some of what we're working with outside with my team. Next slide, please. So for the Homelessness Emergency, we started tracking, some additional data because emergency services are often overburdened, frankly, with calls related to unsheltered homelessness. We started tracking the fire department and police data. So the police department, I'll start over there because they just started tracking towards the beginning of July. And so what we're tracking is all events related to unsheltered homelessness. So from July to, I believe I stopped doing November, I want to say, or October. It's just a few months, either way. 5,675 events related to unsheltered homelessness, which amounts to around 12% of all officer patrol time being spent on unsheltered homelessness, or 22% of their time, 12% of all calls for service, which is a lot when you think about the fact that the homeless population makes up like 0.02% of the total population. And the majority of the call types, almost half of them, are for premise check, unwanted, and suspicious person. And what those calls boil down to are typically very low level, and it's really just the existence of someone in a space that someone else does not think they should be in or does not want them in. That's really what that boils down to. So if we did not have so many people outdoors, these calls would reduce drastically. For the fire department, they began tracking in February of 2024. And we were really just looking at the difference in calls related to fire and calls related to emergency, like health, medical stuff, EMS, rescue stuff. And you can see by far the majority of their work is spent on EMS and rescue services. And that is largely to do with, one, the existing fentanyl crisis, which certainly does not solely relate to the unhoused community. I think, I watched Dr. Melnick and his crew give a presentation here where he talked about like 91% of the overdoses were people who were housed. So I think that shows it's not just an unhoused issue, but 10% were people who were experiencing homelessness, which again, they're overrepresented in that as well. So a lot of the fire department's work is rescue work and chronic health conditions. Yes.
Spinelli, really quick. So the EMS and rescue, the 2,489 calls, you mentioned a lot of those calls are overdoses, but they include people that are housed.
No,
Or
these are
no?
all related to unsheltered
Just
homelessness. This
unsheltered,
is
okay.
all people living outside.
Got it. Okay, thank you.
Mhm.
Is there a percentage of calls for the fire department
I'd have
similar
to-
to VBG?
I'm sure that there is. It's, they don't give me that, and that they give me their data in different forms.
Okay.
But I can get it. I can get it
Okay.
for sure. And then 383 related to fires. And I mean, interestingly, I will say it's not a exact comparison because the year before we were averaging calls for fires at camps. It was around 20 or 21 per month. And then this is closer to like 40, 45 a month. But again, we were not specifically like intentionally tracking last year. So that could also be a reason for the difference, but it is a pretty significant jump. Next slide, please. So one of the other things that, I mean, we're tracking for the emergency, but it's something that there's a group of us who, for the Homeless Memorial each year in December, have kept track of people who have passed away related to the homeless community each year. That's something I continue doing. And I want to make sure that this is clear because I got a question about this the other day. All of these deaths that you see, so we had 54 from the Homeless Memorial in 2023 to the Homeless Memorial in 2024, because that's like mid-December through mid-December. They are not all people who are living outdoors. Some of them are living in shelter. Some of them are unsheltered. And then we also track those who pass away in a supportive housing program because they are still connected to the system. So we're able to see that. Usually, so this number is just what I tracked myself in this group. Typically, each year, Council for the Homeless prior to the memorial runs an HMIS report, the Homeless Management Information System, to see if there are any that we didn't capture just kind of on our own with knowing people. Usually there's about 10-ish additional that end up adding to the end of the list. This year, they have not yet run that report. So 54 is going to be a minimum number of people who passed away over the year. Which is a 29% increase in the number of deaths we experienced last year. And that's without the additional folks from HMIS. So probably an increase, probably more than 30%. Last year, and it maintains to be true this year as well, or 2024 as well, overdoses and SUD-related, substance use disorder-related deaths make up for half of these. Half of all these deaths. It should probably be noted that of the overdose and SUD related deaths this year, none of those occurred in shelter. Those all occurred, most of them unsheltered. There were a couple that were unknown housing status and the remainder were in supportive housing. 91% of people who got hit by a car, killed by getting hit by a car, or experiencing some kind of violence were unsheltered. Well, 65% of the total deaths there that you see were experienced by people living unsheltered, and that's a 50% increase from 2023. So there are various, if you look at like the fire, the medical, violence and suicide. So you can see, I mean, you can see how it's related to the emergency services, right? Cops and or AMR getting called to nearly all of these. So we're looking to bring those numbers down as well. Next slide, please. So one of the strategies we are utilizing to address all the impacts and then some that we just mentioned is establishment of a large, what we are calling a bridge shelter. Lots of people call them many things, navigation centers, just shelter in general. We liked Bridge Shelter because I think it really does show that the purpose here is to bridge someone. It's not just a place to warehouse people so that we don't see them. This is a place to bridge them from homelessness to housing in a very supportive, service-rich environment. I'm not going to read that entire thing because I'm sure you guys have been here all morning. But the goal here is to provide all the things in it, the immediate needs, food, shelter, clothing, those very basic things, but also stabilizing services, because we don't have enough housing in this community countywide, right? We know that we don't have enough housing. We don't have enough that's affordable. So people are going to be sitting. And the idea here is if they're going to be sitting inside of a space, hopefully, equip them with all the things that they need to ensure that when they get to housing, it's much more likely to be long-term and sustainable. Because people, as I mentioned earlier, people who are living outside or who enter unsheltered homelessness for the first time very rapidly pick up a lot of barriers and challenges to forward movement and stability. And the longer someone's out there, the harder it is and the longer amount of time it takes to get back inside and be able to keep it. So next slide, please. I'll go into more detail about what that looks like. Okay, so who will we serve? We're looking to serve really anybody who lives outside. So I've given you a breakdown of who actually is living outside as of the 2024 count. But we are really focusing on adult individuals or couples experiencing unsheltered homelessness with a specific focus on mental and behavioral health and chronic homelessness, for all the reasons that I just previously mentioned. In the report that counts for the homelessness to HUD each year, this is where I got a lot of these numbers from. There were 200 of the people experiencing unsheltered homelessness reported in that count. 278 reported experiencing a severe mental illness or chronic substance use. There were 117 of those who identified with the definition of chronic homelessness without children, to be clear. So these are, I'm only talking about the people who would be relevant for this shelter. So just adults. People of color made up 39% of unsheltered individuals in 2024, with 14% of those being Pacific Islander and Native Hawaiian. We have had just in the entire system, sheltered and otherwise, a pretty significant jump in the number of Pacific Islander folks who are experiencing homelessness because we have the highest eviction rate in the state, and that is, I think, particularly true for that community. And I know that we're kind of all, as a community, doing as much as we can to get some eviction prevention supports and just supports related to housing to that community, rental assistance. But until such time as we have that kind of safety net, that number is probably going to increase. In fact, the winter shelter that I mentioned earlier, the majority of the families who are in there are Pacific Islander families. They also live very multi-generationally, so they tend to be larger families often. So there is, in addition to the work that we've done with Secure 39ers just on the street outreach and the homeless outreach, we're working on some additional things. So they were part of the RFP, like the scoring committee for my RFP for the service provider. So we're really trying to work very closely on that because some of them can be, particularly those who are living unsheltered, like individuals, like down in Burnt Bridge, there's a great deal. We're trying to make sure that we are creating a space that they want to come into, that they're comfortable coming into, that is culturally relevant, meets their needs. So we'll be continuing to work together to ensure that the shelter can meet those needs. 37% identify as female, with 2% being non-binary, trans, more than one gender, etc. Those are obviously lower than like the majority number. We have mostly single men who are in this unsheltered demographic, but it's not. We have people who need. Who are often less comfortable in shelter settings. So we want to make sure that we're doing everything that we can to create an environment, as well as have operations that can meet the needs so that they're not living outdoors where they're much more vulnerable to things that are predatory, violence, things like that. And then as it relates to age, I don't know if you all have heard maybe in reporting, but we are seeing an increase in the number of people who are older entering homelessness, largely because of housing affordability, paired with chronic health conditions. They're often on fixed incomes. Many of the folks that we've had at Safe Park who don't come with kind of the standard challenges or barriers that you might see with someone chronically like homeless or chronically unsheltered. It's literally just affordability. We've got lots of people who are just on fixed incomes who have been priced out. And because housing is like for housing programs, the way coordinated entry operates is prioritized based on vulnerability, which is that's learned in a very specific way with an assessment through Council for the Homeless. And because they don't come with some of those more significant barriers, they don't often score at the top of that vulnerability range. So they're not being prioritized for housing in the way that someone with a lot of health conditions, mental health, substance use, with many barriers would. So they are kind of sitting stagnant in shelter or in Safe Park, for example. But the bulk of our the bulk of the population certainly is that 25 through 54, which is also very close to the age range that's most impacted by fentanyl usage, based on that data. Next slide, please. So we wanted to I'm going to be honest, we're asking a lot of this shelter. Poor Kevin is having to try to help design something that meets all of the needs that I'm like, oh, we have to address this. One of the more significant needs that I've seen over my time, and probably any outreach worker would explain this, would say this as well, we lose people in transition from one space to another, whether it's from jail, or discharged from the hospital, or leaving inpatient treatment or detox. We are losing people in that space. So they go into a place that that can stabilize them, and then because there's nowhere to exit directly to, we lose them again, and they're repeatedly in and out of any one of those systems of care. We often have people who will say, I mean, they won't bother going to treatment or detox, knowing that they don't have a place to exit to when they're finished. So it just contributes constantly, compounds, how difficult it is for people to be able to stabilize. So certainly partnering with the JAO, with the reentry program specifically, if that were an interest, is something that I've always wanted to do. I think it would fill a significant need. But we also see the same kind of gaps with law enforcement. I'm sure it's the same with CCSO, but I certainly know with Vancouver Police Department, they run into a variety of things, typically at nighttime when no services are open. Whether it's an elderly person that's in their car and they've just recently been evicted or just recently noticed, women fleeing DV, all kinds of situations, and they don't have anything to offer. So being able to directly connect law enforcement to shelter space, I think would be a massive benefit to the whole community. It's one of the things that we're working on. That certainly will happen with VPD. And then community court. One of the we've got a really excellent partnership with community court. And what I mean by we is the Heart team and My Safe Stays and the community court. And community court is often people being cited into community court are often people who have been a little reluctant to engage in services. And that's one of the reasons they are eventually cited into community court, to get them to engage. And once people engage, you kind of see this pretty swift turnaround. But again, just like people in treatment or hospitals, if they find a little bit of stability and they're connecting to this support, it's very difficult to maintain that when you're living outdoors. And so we've been able to work with the safe stay providers when someone has really made some progress and it can start to envision something different for themselves. We really work on prioritizing those folks for openings at safe stays whenever we can. we don't have enough safe state capacity to be able to do that with the number of people who are utilizing community court. I don't know if you know this, but community court just basically expanded their capacity. It's gone from a half-day program to almost a full day now. There are so many people being cited in and opting in and engaging, which is actually the most impressive part of that. So that's a partnership we'd like to be able to expand with access to additional shelter capacity. I know that the role of coordinated entry, I specifically listed this because that was a question that was brought up previously. And so I thought it might be beneficial to explain coordinated entry to make sure that we're not missing each other, and then explain why I feel like having referrals only come through coordinated entry then becomes a barrier to all those other things that we wanted to be able to work on. So in many communities, shelter actually acts as a point of entry into coordinated entry, versus the way that we do it here locally, which is you have to access coordinated entry to be referred into shelter. It is not a requirement of HUD or the state. I've looked at the state requirements. They actually don't require that shelter referrals go through coordinated entry. They would like for all organizations, all pieces of the system to be connected to coordinated entry. But it is also, like I said, it is very common in most other communities for shelter to be an entry point into that coordinated entry system. Because they are not only a referral point into shelter. They also track, kind of a variety of services with HMIS. They track people, their whole movement through the system, what services they access, how long they've been in the system, if they come back into the system after being housed and maybe losing their housing, and then they utilize that same system for referring people into supportive housing, transitional housing, etc. So shelter can very much be connected to coordinated entry and an active part of coordinated entry while not receiving all the referrals from coordinated entry solely. The reason that is such a barrier is because, similar to how I mentioned the people prioritized based on their vulnerability and their housing assessment score. So it's very similar with shelter. So when someone calls into to the housing hotline and says they need shelter, some basic questions will be asked. They will often be told they should do a housing assessment, and they'll go kind of like on a priority pool list. That's not true for winter shelter. That's mostly on a first come, first served basis. But for most shelters, they're doing the highest vulnerability. But basically what that means is you can't just reserve a spot. If you call today, likely none of you would be getting a shelter bed tonight. Probably no one in this room would be getting a shelter bed tonight. So if I'm at the hospital, or I have a client that's at the hospital and I'm about to be discharged, and a social worker says someone needs to, let's see if we can connect you to shelter from here so you don't end up right back outside, they're going to get the exact same response, which is, okay, we've put you on the list. There is no prioritization or ability to do that directly for any of those systems of care. So the same thing's going to occur from jail. They're going to be put on to the list and prioritized on that list based on what their score is and where they fall in that way. So any stability they have gained, any momentum, forward motion that they've gained in this place is very likely to be lost, because the majority of them are not going to be referred into shelter directly from where they are. They're going to fall through that gap. In fact, whenever so I don't know if maybe some of you know, Council for the Homeless received a private grant, I think from Jeff Bezos, I think is what it was, about a year ago, a little over a year ago, like $5 million for families. And one of the things that they did is pulled several stakeholders together into different meetings. Some of them direct service providers, some of them kind of system folks, and was wanting to know, what are the gaps that we could fill with these dollars? What are the needs? What are you seeing? And many people around those tables, mental health folks, behavioral health folks, outreach workers, what they cited was we need something immediate. We need some immediate options for people. Because I have somebody who's going to be released from treatment or jail or whatever on a Friday night. I don't have somewhere. I'm not working. I don't have somewhere for them to go. Friday night, Saturday, Sunday, and by Monday, I very likely lost them. So we're losing them in that transition. And there obviously excellent discussion was had around, well, okay, once they're in housing or once they're in shelter, then where do they go? Because we also don't have enough housing. And there is for sure a balance that has to be struck there. There's no question we should not be dumping 100% of all of our dollars into shelter alone. We should be doing both because we do also have to have places for people to exit shelter from. We shouldn't just be warehousing people. But I do know that at the safe stay communities last year, 60% of our exits from the safe stays did so in a way where they were able to self-sustain. They didn't even need to, they didn't have to use housing programs or go through the homeless crisis response system for their housing. So if we can use shelter in a way that helps us divert people away from that system, it helps us take the pressure off of what is a very long list and overburdened system. I think that pretty much covers that one. I think that the point there really was a shelter provider can participate in coordinated entry without having to take all of the referrals from that place. They can be a point of entry. Next slide, please. So updates, these are the details that I did not have last year because all this was done just in the last few months. So in October of 2024, we contracted a shelter operator. So that's Do Good. They are who operates our 4th safe stay community. Currently, they're contracted for phase 1, which was just for planning and design. But assuming they still want to work on this, whenever we get to the next phase, they will pick up the contract for operations. In November, our council adopted a B&O retail tax specifically to support the bridge shelter project, whether it be for capital now and operations as soon as it's open, but that was adopted as part of our 25-26 biennium budget. And that fund is dedicated solely to this project. In December, we approved architecture and design firm contract with SEA. Is that right? Scott Edwards. Yeah.
Scott Edwards Architecture.
Yeah, they're great. And work is well underway at that point. In January this year, so just actually a couple of weeks ago, we contracted with on-site medication assisted treatment provider because that is a large part of this project because of the fentanyl issue that I mentioned earlier. The best way to attack that is with immediate access to treatment. And if you know anything about just the kind of the intensity of that drug, the impact of that drug, it really is taking medication in conjunction with other supports, but it is taking medication to really be effective. So people would have on-site daily access to medication-assisted treatment through Columbia River Mental Health at this shelter. And then the location, we kind of solidified the location. November, the location was proposed, and we did all of our initial community engagement. And in December, council approved property acquisition and specifically utilization of that property for the bridge shelter. And we are now in planning phases. I go to lots of planning meetings every week now. Next slide, please. Okay, so this hopefully is going to provide as much of a kind of a picture of what will be in the space, what the space will offer as we can. Again, we are still planning, but we will have the on-site behavioral and mental health services with the medication-assisted treatment program. We're also working on expansion of Columbia River's kind of regular mobile health team They have a mobile health team now that serves county-wide. As I mentioned earlier, a lot of people who are living unsheltered are doing so in Vancouver city limits, but serving county-wide, and their focus, like required to be on rural areas, means that they can't spend as much time where the largest issue is. So we're looking to expand their program, and that will partner with their medication-assisted treatment program at the Bridge Shelter. So folks who are living in this space will receive a greater deal of continuity of care. It's very challenging to get people who have lived outside for a while, people experiencing homelessness, to connect with primary care, to go to kind of regular doctor's appointments versus the emergency room. If some don't even go to the emergency room when they should. But they have been very receptive to Columbia River's mobile health team, who can do some of that minor medical prescribing. They've got peers. They have the ability to kind of wrap fully around somebody with health care. So people moving from outdoors to inside the shelter will be able to keep the same provider until they are able to move on to something more, until they're more comfortable moving on to something more kind of standard versus the mobile option. It is very important to us that this be a low barrier and trauma-informed shelter, trauma-informed space, for all the reasons that I mentioned earlier with the specialty populations. But it is difficult to get some people to come into shelter, particularly one that's going to be largely congregate. We're trying to figure out how to do that in the best way possible while still providing for some level of privacy and dignity. It's difficult to get the kind of capacity you need without having it be at least partially congregate. So we need to make sure that we're kind of compensating for that in all the other ways. So we want to make sure that we're including infrastructure to support the three biggest barriers to accessing shelter, which are partners, pets, and possessions. So people will be able to come in with their partner, they will be able to come in with their pet, and there will be some storage space on site, not massive amounts, but reasonable amounts of storage, so that people are not feeling like they have to leave all of their worldly possessions behind in order to come inside for shelter. We are intending to make sure we have capacity to expand for severe weather. Currently, we're using some city facilities. We will add some amount of capacity for winter weather. We don't expect that it will be the entirety of what the community needs. It's not going to be 150 additional beds for severe weather. I think it's a best practice that all shelters be kind of equitably spaced around the city anyway for good access, but there will be some additional capacity. We're looking at a commercial kitchen for inside this space, potentially to be able to serve both that shelter as well as some of the other shelters who need it, and hopefully some employment training, which I'm kind of excited about. It's much more cost effective to have a kitchen. While kitchens are expensive, it's much more cost effective to have a kitchen on site than it is to order your meals. I think it was like about half as much to actually have a kitchen than to order meals, pre-made meals. There will be hygiene and laundry facilities, so standard restrooms, showers, laundry. It's very important to have a heat treatment room so that people can put their things into what's kind of a hot box, like a sauna. It kills bed bugs if there are any there. It's all for pest control, just for basic cleanliness of the space. There will be both indoor and outdoor common areas, as well as some spaces where, because it's congregate, people could get away to a quiet space, when they feel like they can't in the sleeping area. There will be plenty of office space and multi-purpose space for those wraparound supports that I mentioned. We are looking, like I said, at mostly congregate with the possibility of including some individual non-congregate space. That's going to really be based on budget and timeline. And one of the things that we are really trying to focus on is building for both current needs and future needs and capacity. Because it could be that budget is what it is now, and but we can add infrastructure now that sets us up for a phased-in approach for additional capacity. I have the box up there on the still to be determined, because I know we've talked previously about using like a sprung structure or that tensile fabric type structure. A structure type at this point is kind of undecided. The designers are looking into what will fit within existing budget. Bed capacity is still kind of up in the air. The goal is to get up to 150 beds. That could occur in phases. Again, that's something that's largely up to budget. And then still working out some details with potentially Peace Health and maybe some other hospital providers, but currently medical and behavioral health respite, like I don't have that locked in just yet. I would love to do it. But again, that all of these things cost money, and we are on a timeline, a very tight timeline. We're looking at a mid 2026 opening date, which is a very short amount of time, I've learned from Kevin, to do a project like this. But this is an emergency. We have declared an emergency. All the data shows us that this is urgent. So we are trying to get this open as quickly as we can to reduce deaths, to reduce these impacts, which means that we might have to sacrifice in some of the other areas, whether it's capacity, whether it's some of the cool things that we're going to have that are needed to do this project well. This is not a project that you can do where you are just sacrificing all of the things that actually make it stabilizing and supportive.
Jamie,
Yes.
really quick question for you. So I've been following this project for quite some time now. And so that number 150 bed has been very consistent since its inception. Now, the last bullet point, when you mentioned that you're building for current needs, that's 150 beds, and future needs, what does that number look like? And I hope that we wouldn't have to, add any more, because we don't want, people living out in the streets. But what does that number look like? Do you know? Any idea for future needs?
Well, I mean, you can if you want, yeah.
Sure. So this is Kevin again. Honestly, the biggest deal is that though we don't know the capacity that we can put in the budget, we do know most likely we can't afford the 150. So part of what Jamie was mentioning about the phasing is you heard all of what Jamie shared. We have a demand much higher even than the 150. And we want to get as close to that as possible. And right now, though we haven't done all the costing, we've done enough work to say that we cannot afford the 150 as we currently know. And so what we're trying to do is, get all the resources we need to maximize the opportunity of the site and all those things that Jamie mentioned that we've already put in place. And now we're looking for ways to do that maximization so that we don't leave something on the table, right? Leave opportunity here. And the biggest one about the timing, really, if you sort of imagine, is the infrastructure, right? Some of the infrastructure you put in is really expensive. There's everything from, making sure you have the power, making sure you've got the sewage lines, making sure you have the water. And so understanding kind of how big we're going to be able to go, both in terms of a capital cost and operating, will allow us to put the infrastructure now to be efficient with that. And then so the phasing that Jamie mentioned could be like, oh, okay, so I've got the basic structures in place. I know where I'm going to go. And now I'm going to be phasing in over the next however long it takes to achieve that maximum capacity. Does that make sense?
In regards to the number of people, I mean, we've got 500, right? Typically living unsheltered at any given time currently. Even though we're at a good place where we've kind of plateaued a bit, I mean, population grows, but the population in the homeless community grows just like the population of anywhere else grows. I know that it's also, part of comp planning efforts to make sure that you're planning for the correct number of permanent supportive housing, affordable housing at the different bands. And that includes emergency housing. I want to say the number that I think I heard for Vancouver over the next 20 years is like 1,000 beds, 1,000 emergency beds. So I don't think we're ever going to reach a place where a community is never going to need any shelter, where you're going to be shutting all of your shelters down. But I do think that you can build a system that can expand and contract with need. And I think that that's probably the ideal situation, right? Because right now we already don't have the kind of safety net that is needed when people reach a crisis, an emergency in their life. So here we are trying to figure out how to prevent people from ending homelessness, which or from entering homelessness, which that costs money, right? We are trying to keep people housed, which costs money, and then we're also trying to play catch up on the number of people who have been outside for a super long time. So it's a difficult balance to strike, but I think that we're going to need. I mean, we'll probably end up needing 2 of these at some point, or at least that kind of capacity, you know? And I think that mixed with some, I think I did not mention some of the independent space that we're talking about, because I mentioned mostly congregate, maybe some individual space. We're talking about adding some pallet shelters or something like that onto the site to provide some independent space, but also some flexible space for kind of emergency situations. Again, people who are exiting DV, someone who is maybe gender nonconforming and is just better off in that space. Maybe somebody who has 3 dogs and having 3 dogs in their 1-bed space is not ideal. Somebody leaving a mental or another healthcare setting, you know, maybe is better off in a space like that. Or maybe there's spaces that people can transition into from congregate space as they work on their transition out of homelessness. But having some of that individual space, again, that might be something that's phased in, but I think a good and important part of the overall system.
Say, Jamie, I would like to just check in with you because
I'm
I
done with
know.
slides.
Oh, you're done with
Yeah.
slides. That was my question because I know the council will want to have some time to discuss.
Sure.
Thank you for
Mhm.
this wealth of information and all the work that you've done to put this together. It's really appreciated. I'm grateful for the presentation. Are there any immediate questions or comments?
I think Councilor Little was first.
Okay, go ahead.
Yeah, just want to thank you as well for providing all this information. I just want to jump ahead and ask to Kathleen, what are our options if we wanted to help support this bridge shelter? Is the only option going back to the mental health sales tax, and that would be another, what would be the timing of our options?
Well, currently the mental health sales tax does their RFP process annually, and it's the recommendations of that come to council during the annual budget process. So that's the current established process as established by council when we started that.
And that's the only source of
Well, general fund is
potential
the
funds.
only fund that does not have restrictions, but unfortunately, I would not be recommending any general fund for these services because it's not sustainable for us.
Just following up on that, I know some of those mental health sales tax funds are already obligated. So at some point, it'd be good to know what money we may have.
And we can pull that up.
closes
It
over.
was part of the annual budget presentation that showed the ongoing, we have a 6-year forecast for mental health sales tax. And we can pull that up if council needs to see that today. I did send it to council last week too.
Thank you.
So that
Sure.
was my follow-up question, whether there's any funds left over or that we would have to wait again for the next round toward the end of this year.
I will pull up what I sent to council last week. And I know Emily's on as well.
Councilor Belcott, you were next.
Yeah, thanks, Jamie, for this presentation. I was wondering, what is the success rates for rehabilitation? And I didn't see, or maybe I missed it, what rehabilitation services would be involved or offered?
Do you mean like treatment services? Because that's what
Yes.
yeah.
Yes.
So the medication assisted treatment program with Columbia River Mental Health is one that I mentioned. So we've contracted with them starting in January. And they're going to be launching that probably a little bit early because it's going to be a mobile project, and that's really to help people stabilize where they are now prior to movement into the bridge shelter or shelter in between now and then. And then be able to continue that care when they move into shelter.
What is the percentage of people at the safe stays taking and accepting rehabilitation services, and what are the success rates?
I'd have to look at I'd have to check for sobriety specifically. We have lots of people who live in safe stays who have not necessarily needed to go to treatment, but have been able to do just kind of become clean and sober if that's an issue for them, and maintain it on their own, just given a more stable environment. I can tell you that like positive exits from the site is somewhere around 40. I think if I'm averaging across all the sites, somewhere around 40%, which is it's a little higher than some shelters, but pretty average overall. It's pretty standard. Does that answer that's not rehab
Yeah.
necessarily, but people being able to move out in a positive way, I think is.
I
is
think
kind of how we-
Columbia River Mental Health might be able to help with some of
Mhm.
what you're asking, Councilor Belcott.
So the bridge shelter won't have any on-site rehabilitation services. They will go elsewhere to Columbia River Mental Health.
No, it will be on site.
Okay,
Columbia River will have that on site every day.
okay.
Now, right now,
And-
they're launching a mobile and
Yes.
ultimately it'll
Yeah,
be
that
on
unit's
site.
being built currently, and it will be at the site every day, and then it will go out and be able to serve people at other shelters, supportive housing programs, and encampments, etc.
Thank you.
Okay. And then what are the standards of staying at the bridge shelter, and staying there? Because I know that you mentioned in the past that there were standards, at the safe stay. Would it be similar to what the safe stay standards are?
It would be very similar. Really, so there's no at the safe stays or at this space, there would certainly be no requirement, kind of more stringent requirements for entry into this space. People need to be able to, kind of behave themselves, be a good neighbor to the people who are living inside the shelter, as well as people outside. We've been very intentional with all of our safe stay and safe park communities, to be doing community building both within the space, but also with the surrounding neighborhoods. And I think just the support of all the neighborhoods currently, that currently host safe stays, is a testament to how well that has worked. It's very important to us that we are not building an island unto itself that just exists independent of the neighborhood around it. So people are held to behavioral standards, while they're receiving treatment services and other supportive services that they need to really stabilize and move forward.
Right, thank you.
Thank you. Councilor Young?
Yes, thank you. One of the things that I've really appreciated about the safe stays is, and I'm hoping that the policy remains the same. I assume it is, but I just wanted to make sure. I know that there has traditionally been real hesitation from individuals who are in shelter space to leave for things like rehab, for detox, because there's such a shortage of shelter space that when they exit that service, their space has been filled the minute they left and vacated it. And I know that the safe way you hold those spaces available for return after those services, is it going to be the same at the bridge shelter?
Yes. Yeah. The goal here is to fill a lot of those existing gaps. And the service provider is on board with that as well.
Okay. And then just kind of a comment along the lines of funding discussion. I think, but I would need to defer to staff, that the opioid funding could potentially be used as a funding source as well.
Well, I don't have the answer to that. So we would have to look into that. And I assume that do they have a similar RFP process that they go through for issuing that, which is also part of the annual budget process?
Yes, and actually, one of the large points of our discussion in the meeting earlier this week was where there's a lack of direction currently. At this point, we went through our first round, but there's no policy as to whether we approve second year, third year, like if people need to reapply, or if we have it. So we're at a point where we need to take a look at the process overall with that.
But just as I'm familiar with that, it does seem like this could be, if there's opioid treatment.
Yeah, we're using some of our own opioid dollars for part of this. Yeah.
Right. Other questions? Go ahead.
Does fentanyl fall under opioid? I'm
Yes.
not familiar with the drug. Okay.
Yes.
Got it. Thanks.
Chair Marshall, can I ask a couple questions?
Yes, absolutely.
Okay, it's just for clarification, because I have listened to a lot of the community groups, and so I just want to make sure that I am understanding correctly. At one of the community meetings, it was stated that anybody with a criminal past would not be allowed in the bridge shelter. And so, understanding you want to work with the jail potentially, can you clarify if that's, because I have heard that stated at a community meeting?
Yeah. So it's not anybody with a criminal past. We have agreed to screen out sex offenses, so people convicted of sex crimes, but not the others.
Okay, so that's the only one?
Yeah,
Okay.
because
thank-
it's super common for people experiencing homelessness to have some kind of.
Yeah. And are
That's right.
you in communications now with the jail staff? Because I know like Anna and Dave, they're really building the reentry program and wraparound services. So what are you doing? Because for me, it's, yeah, funding, well, council will discuss that, but there is an opportunity now to partner and see what we can do now.
Yeah.
Have you had ongoing conversations with the jail staff?
Ongoing, no, largely because I've been busy with this portion of it, and some of that really does depend on partnership with funding, because currently everything that we have to pay for this shelter is local city dollars. So we've been very kind of limited to the way that we do things with the safe stays currently, which would be challenging with the jail. I don't think impossible, because certainly some people who are arrested come from the city of Vancouver. So I can.
Yeah, I would encourage that, because sometimes we can find creative ways that are not costly, that we could do small wins now and
Sure.
not wait for additional funding. And as you're having those discussions, thinking about how would you transport people from the
Mhm.
jail to the bridge shelter. One of the other questions I had is on the number of beds. I've also heard in the community meetings, I think it was with the provider or the operator, that they were like no more than like 60 beds. So that's a little different than the 150. So that number has been fluctuating in some of the community meetings that you guys have had. And so can you clarify on that?
Well, I mean, the operator that we contracted with, they wrote their proposal understanding that it was up to 150 beds. And that is the goal, is up to 150 beds. Again, without Kevin's portion and the design and all of that, without having done all of the costing yet, it's difficult to know what capacity we're going to get out of the limited budget that we do have.
Okay.
But we're shooting for 150.
Okay, because when I heard the discussion, it really was the operator was like, it's not going to be successful, and that they would not run it with more than 60. It was said in a public meeting, so I'm not making it up. So this isn't stuff I'm just making up. This is actually what's been discussed with the city, with the operator in community forums. So I just want to, it just causes questions, which I know there's a lot of planning.
Mhm.
And I think that's the part of the planning process, is trying to figure out what the needs are so that you know what the costing is versus we need this cost and then we'll figure it out. So I think for me, that's because, we have a jail work center with the industrial kitchen.
Mhm.
I mean, can we do that for free? Probably not, but there's an opportunity maybe as another partnership, as maybe a low cost, to use that to support. So I think from my perspective, having those discussions with all of the partners within the county and other jurisdictions will help you guys develop what you need based on best practices, and knowing that versus, we need $10 million and then we'll figure out what we can do with it. I mean, that's just my perspective on that.
Thank you for those questions. Jen, any further comments related to those questions?
The only thing I want to say is that we've done a bunch of work to talk about some of the demand, so how much we need, and we've talked about some of the ways, the limits of what we can provide in a single site, for example. And the 150 comes from a bunch of work, and it wasn't just from us. We had consultants who do this kind of for a living, have their own shelter systems down in San Diego, who helped advise us to both look at the system writ large, kind of where the gaps were, but also specifically to help us identify where the highest value investment would be. That's kind of where this bridge shelter came from. We both had our experience here, but we actually got external validation from some experts in the field. And so the issue now that we're trying to do is get into the details of what that is. And as I've mentioned, is that we don't know yet because we haven't done the work and the costing to figure out what the capacity is that we'll be able to do. But we are going up to 150 with the likelihood, again, what we do now, what we have heard to date is that without additional investment, we won't be able to achieve the maximum capacity, and where we think there's a gap in opportunity is kind of what I was trying to talk about previously.
So if I have one quick follow-up on the
Yes.
budget. So hearing, and I think this was, you guys presented this during your mental health sales tax submittal, that you're not looking for this to go online until mid 2026.
Yes.
What do you need now that couldn't be considered part of our annual budget process? Like, what is your request today? Because I think that's why Councilor Young suggested this to come back to council, was that it was moving a little quicker and that there might be funding options or funding needs now. And why would those needs need to be considered outside of our annual process?
Sure, I'll take a stab at it, and Jamie can help me. I'm not sure cash in hand is what we would need immediately. So just to clarify, but commitment, we would, and this really has to do with just the process, right? I'd mentioned before that we've got to start designing the infrastructure, so we got to decide how big this is going to be. And infrastructure isn't cheap. So you don't just go and if you're never going to be able to fill out the capacity, you don't build a bigger infrastructure. That's super inefficient. So we're trying to figure out is how much are we going to be able to afford in terms of the capacity? And that's going to, and that's what we're doing now. We're designing all of that. We're designing what in the architecture world we call the concept phase. The concept phase is where the majority of the big decisions are made. And that's going to be done to achieve that mid 2026 date. That has to be done in February. So that's when we define how many people are going to be there. That's when we define what we call, again, using architecture terms, the program. So it's like, how many people are going to be there and the different kinds of the elements of the design. So it's the kinds of details we put in there, the hot box for the treatment, the details of how the medically assisted treatment facility, how that's going to be worked. Those are those programmatic elements. And those all need to be defined in February for us to do those next steps to meet the construction deadlines of getting us done and open to some capacity in the middle of 2026.
I can appreciate that. We're working on our jail. Same thing.
Yeah.
Any other questions from the county manager? Any other questions from the council at this moment? I have a question related to the budget. So thank you for bringing this up. So it looks as though projected available fund balance for new requests for 2025 is $4,209,000. And of that, I don't know if there are multi-year grants that will already be, if any part of that is already dedicated.
I think that, and Emily is on, but I think everything that is reflected in here is everything that's dedicated based on the recommendations to council.
And so that would be dedicated for new request.
The new,
The 4 million?
yes. And I would recommend not spending all of that funding. Just from my conservative budget, we don't want to dip in and go upside down on that. But Emily, and I think that Emily, for the external too, based on the current process, what's the time commitment that we do? Because I know we do different for internal and external.
Correct. So just to clarify, that 4.2 million is a one-time available fund balance. And the timing for the internal applicants, we usually ask them to submit a month or two prior to the external RFP process, so those decisions can be made about the internal commitments. So that would be, if externals due in August or so, it's usually June. We're having those conversations about what they're planning to submit for ongoing requests for staffing and county programs.
And Emily, and or Jordan, because I know he was part of this process, for the internal commitments, in their proposals, was there discussion or notes that there would be like a phase 2 to what program they're having for additional mental health sales tax moving forward after what was approved, above and beyond?
From my recollection, there's no formal commitment of any additional funding. There was talk about needs for future years, for example, for the jail, but those requests would need to come back through the annual process.
Yeah. So and I just for it's my opinion, but that's the value in having that process so that council can see on an equitable lens all the needs or requests that may come through so that you can determine, what makes sense moving forward.
Both internal and external. Great. Now you mentioned February, just in terms of a commitment, not cash in hand. What might that look like coming from the county?
Now, honestly, I'd have to talk to the finance folks about what the details of that are. But from my past worlds, when I've been in similar circumstances, is that we'd be able to work out what the level of commitment is, like what that actually looks like. And even though I can't tell it to you, I have talked roughly to our finance folks, and that they've said, yes, we can do that. But again, the details would need to be worked out, kind of like exactly how and what the timeframes were. And I just, because there wasn't a specific request, they couldn't give me an answer as I was hoping. Was I answering your question?
So you would need to develop a specific request, or we would need to make a specific offer? A little of both.
Yeah, I think probably a little of both, just understanding. So two separate issues. There's one, which is we need to know an amount, right? That what you would be comfortable with. That would be the first step, is to think of what you guys could contribute to help us expand those capacities we talked about before. And what I had a commitment from our finance folks is that we could work out the details of how that transfer would happen and what kind of official commitment, like what is it? Is that a
MOU.
an MOU, right? Like I don't have an answer as to what those requirements would be, but we can take as much as you want to give in terms of like what that is. That won't be the problem, of
It
course.
would be limited.
No, understood. But so because we understand a little bit about our budget, and we understand, I've already mentioned the shortfalls that we have in achieving our goal. So we can already say, hey, I already see a gap. So it's not going to be, the issue is really going to be is if there's some capacity and interest on your side, then we'd want to say, so can you guys commit that? And I would ask our finance team, what does the commitment actually look like? And my hope would be that we would have that commitment, whatever that looks like, in a way that would be fine with you guys by that February timeframe. And then they promised me that we could work out, a longer term, the
if it
details of
occurred.
how long it takes to get the money in.
Okay. So let me maybe pose this to the council. If there is a desire to figure out, because I don't know that we can do it right now, this moment, but if there is a desire to make some level of commitment to be able to provide you with some of that assurance you need as you're continuing to plan this. And my suggestion would be for it to be not necessarily part of the review process, because I think your needs are a little sooner than that. So I'm just going to toss that out for the council to consider.
Chair.
Here, I have a question.
Yes, please go ahead.
With the RFP process, which starts in spring, and people have to start putting their packages together as related to the mental health sales tax, how can we promise them everything if the mental health sales tax committee is the one who vets the packages and goes over them? That's their process. So how can we promise anything without them going through the motions and the submissions of the RFP process?
What I'm suggesting that this would not go through that process. Th- And I'm inviting everyone to consider that.
Chair,
Yes, go ahead.
just to add to that, we had a conversation, I think, last week, and we have gone outside of that process. Lincoln Place 2,
Not for mental health sales.
yeah, it is mental health sales tax. Lincoln Place 2, and then we also approved the motel vouchers in a process that was outside the typical process.
So the vouchers was, yes, at the end, but it still came forward through the budget process and the committee supported that.
Right, but it's still, they did not go through the RFP process on that. We did not have the application for that to review. It was after we had reviewed all the other applications that we received
Yes,
that.
and we did call that out, but the committee did recommend it as well.
Correct, yes, but my point is that we have, this fund is, the priorities for this funding is within our purview as the council. We can change that process at any time, and we have gone outside of that process in the past. I think I've said this multiple times, that this is a decision that needs to be made at the council level outside of the normal process.
That's what we're considering.
Correct.
Other thoughts?
Is that legal? I mean, I know that there are some laws associated with the mental health sales tax. Is that legal to even do that?
I would say any recommendation, if that's done, is contingent on it meeting the criteria that's by law, what mental health sales tax or opioid could
Yeah,
fund.
so,
Yeah, and that's my concern.
right, the dollars have to be spent according to what they are allowed to be spent for, but who receives those funds and how they're used, which organizations get it, that is 100% within the council's purview.
It sounds like there may be a need to do a little more research on that so that we're making sure we're being consistent with the criteria.
The perimeters of the law that was set up with this settlement money. You can't just dole it out to, I mean, there's criteria. I mean, I would want that reviewed. And I know that Mark Gastaway and Emily have said there are particulars with any funding that we spend for anything that's obligated for anything. You can't just, not give money away. That's my concern. I just want to have the background before council goes into, agrees to anything. That's my concern.
Great, thank you. And I think that's our intention, that we want to be compliant with all of the criteria related both to the mental health sales tax and the opioid settlement dollars. Other comments?
I think we're at a really critical stage. There's a need for more beds. There's a need for shelters. I am extremely concerned about our senior citizens that are the group that are highest at risk of becoming homeless. And you're moving really quickly, which I appreciate that. I think that needs to happen sooner than later. I think it's important for us to then examine if we can override what council established before in terms of requiring RFPs, then I will support that, because we need to support this project. And I just don't think we should continue waiting and pretending that this isn't a critical issue.
I don't think anyone was pretending it's not a critical issue.
That's fair.
I think we're all very aware of that. Councillor Little, did you have any comments?
Nope, I think we're headed in the right direction.
Yes, we got to figure out what that direction is. I think if I'm going to try and summarize what we've discussed and the direction we're going, I think the direction we're going is that we're very sympathetic to your needs and would like to be able to help. We have some research to do internally to figure out. There's been the practices that we've had with these funds, and we want to make sure that whatever we're committing to is within those parameters. Now, you did submit a request, so there's that request. You know more now than you did when that request came forward. And so maybe I would ask you to think about what level of commitment, and we'll think about what level of both dollars that might be available and being consistent with the parameters. But so I don't think we can make hard decisions today. I don't know if that's
It would be helpful to know specifically on what you're requesting to use the funds for so that we can ensure it falls within and we're compliance with the law. And yes, and you have what's available there as well, but that would be helpful to know a specific request
a specific request. Yeah, would be good.
because we have to have that.
And I think, you're managing your own funds related to the opioid settlement and mental health sales tax. So you're familiar with those. Oh, do they have mental health sales tax?
No.
The city? Okay, so you're not familiar with that, but you are familiar with the opioid settlement money and are already committing some dollars to
All of it.
that. All of it. So
Yeah.
great.
It would be good to know a reasonable request for both funds from them to us, just so we have some numbers to work with about
Right.
how they would split up a request among the two different funds.
Sure. I think the proposal that we put together last year, and which is very similar to what the former city manager submitted last, I think like April or May, which was roughly 2 million, I believe, 2 million a year. Recognizing that you all don't know if you have ongoing funds or one-time funds at this point, but I would say like the initial ask, just to ensure that we can solidify some additional capacity to make sure we're not limiting the capacity, that we're able to keep it at what we hope to keep it at. Even just the one time I think would be a good starting place. Mhm.
And so the $2 million that's roughly 12.5% increase over our base budget, which would be a significant, that's not an insignificant investment. And we could have a dialogue once you find out more about the conditions that you guys have for those funds, to think about those elements that we can talk about, because we have a large building program. So you can sort of think everything you've heard Jamie talk about, from a commercial kitchen to additional capacity. For us, we've got a whole bunch of things we need to do. And so if there's some limitations on the use of those funds, they can be for capacity, because that's what I talked about already. And that's kind of where some of the limitation is. But if the limitation on your side was, I'm making this up, but had to be a commercial kitchen, you're like, then I get to use that money for extra capacity. So there's some fungibility within my funding internally, that depending on what limitations you might have, that we can move internal to the project some of our other monies that are non-conditional around. Does that make sense? But that's something that we could have a dialogue about, what those, because I don't know those limitations that you might have for those funds. So I don't want to say what we would use them for. Fundamentally, it is for capacity. But
Sure.
again,
Yes, go ahead.
This kind of brings me back around to what my original suggestion was last week, is that we direct staff that we do want to support this project and have them look into it, have them work directly with the City of Vancouver staff to see how that looks, and bring some suggestions to us for different levels of support, and we can deliberate on that as a council.
I was just kindly reminded that the recommendation would be a one-time amount at 2 million or 3, and I'll ask Emily if she can chime in on that for her recommendation. It's probably based on what the available fund balance is.
Right. I wasn't suggesting spending the entire fund balance, because I think there are plenty of pressing needs in the community. But I think that 2 million gives us a beginning framework. And so let me just hear from the council if that's agreeable what Counselor Young has suggested for our staff to work with your staff, bring back some options for this council and maybe your council to consider.
I would totally support that. I just want to make sure that we're focusing also on the opioid potential funding, because that's going to be 5 times the amount it was last year. So we want to maximize that as much as possible, so that there is mental health sales tax money for other good causes.
So
I'm
we're-
not comfortable with this until we find out what the perimeters of this money is associated with. I don't want our budget folks focusing on spending time if we don't know what the perimeters are, if there's limitations to this. I want to know that first.
I think we'll find that out as staff to staff are working on this. And I appreciate your concerns in that realm. Counselor Fuentes, did you have a comment?
Just to be clear, so if we're potentially, well, discussing collaborating with the city of Vancouver financially, we're looking at drawing from both funds, correct? The opioid and the mental health.
I heard any available funds.
Any
that could
available
be,
funds.
Especially those two, but not general fund. I just want to make that
Right,
clear.
yeah.
No,
Let's be
no
clear that no
general
general
fund.
fund.
Yes, but
Yeah.
yes.
Yeah. Okay. Cool. Then I support that, and I hear Councillor Belcott. You know, and I think it is important for obviously to understand that we are within those parameters, and I think that'll come to light sooner than later.
Can I ask council a question? And you can certainly say no. Do you want to hear from other stakeholders who are receiving mental health sales tax internally, or who may request it in the future for certain programs, so that you have an idea of what the request may be? Because some of it might be tied to services that they're provide that could coordinate with it. I don't want to, because I know I'm going to get calls from staff going, oh my gosh, we had this program that we're building maybe in the jail, and this was part of that long-term programming to help with this particular topic. as well."
Absolutely. I think that should be.
And I can do just a high level so they're not submitting proposals, but just so that council can still hear potential needs for that funding, because we're running out of this funding. We had the problem because of COVID, and now we don't have a problem with spending it. So, which is good. I'm glad, but there's a lot of needs.
Right. Yes. I think that would be important to include that
you.
information.
Yes, I agree. I also would like to get a better understanding of, because, you know, we just got that information on the opioid abatement council. So I'd like to understand the nature of that boost, whether that's something that can be anticipated again in the future. And also, I know there's a time limit on how long we're going to be receiving those funds. So I think all that information would be important.
I think that could be a decade.
I think you're right.
Other thoughts?
I think that's a really good idea, because I know that Amber's not here today, but she has mentioned that that funding going to various different jail programs, courts, and things of that nature that could really help our county programs. So I think that's a great idea. Thank you, Kathleen.
And to be clear, a lot of those are county-wide services, are not just our jurisdiction.
Right. There's needs all around. Great. Well, I think it's good to wrestle with this more, see what we can come up with, consider all things. We don't want to undercut any of the services that the county's providing or hoping to provide, but we have heard you about the imperative and appreciate all of the efforts that you've put into this. You've been really forward thinking on this.
Thank you.
Chair, just one last
Yes.
comment, if I may.
Go ahead.
So I appreciate the comments that county manager made too in this collaboration. So our support, not just financially, but support it in all ways that are possible.
And I would like to volunteer Jordan. I just tried to tell him to be our point of contact with the county and the city and the jurisdictions. But my ask is as specific as you can, so that we can check the boxes that whatever funding that may get allocated meets the criteria of the law.
Yep, will do.
I think it's very difficult for government to be nimble
It is.
and respond to, and this has been an emerging issue, crisis really for a long
And-
time.
And please reach out to the jail. They are willing and able and want to do what's right for those who are in there and to make sure that they're in the right place when they leave. And so I do think that there's a lot of low hanging fruit that can be done outside of this discussion with the funding.
So I appreciate everyone involved. Collaboration is not an easy process, but I think the benefits are worth the effort. So thanks a lot.
Thank you, council.
Thank you.